from the Psych Hub Podcast Network.
Hi, I'm Marjorie Morrison.
And this is Patrick Kennedy.
And you are listening to the Psych Hub Podcast, The Future of Mental Health. Welcome back to another episode of The Future of Mental Health. Today we have an incredible conversation with Dr. Don Mordecai, who is the national leader for mental health and wellness at Kaiser Permanente. He leads the national initiatives for Kaiser Permanente in the areas of care delivery, reducing the impact of childhood trauma, including adverse childhood experiences, otherwise known as ACEs, stigma reduction, and the use of technology to improve outcomes in mental health and addiction care. A practicing child and adolescent psychiatrist, Dr. Mordecai works across the organization to identify and deliver innovative ways to improve the mental health and wellness of individuals and communities through prevention and strategies that address mental and physical health issues upstream of their causes. Prior to his current role, Dr. Mordecai was Director of Mental Health and Addiction Medicine for the Permanente Medical Group. He trained in child, adolescent, and adult psychiatry at the Stanford University School of Medicine and is Adjunct Clinical Professor of Psychiatry there. Now, to our conversation with Dr. Mordecai.
Well, thank you, Marjorie. I appreciate the invitation, and I'm really excited to be here with you and Patrick to talk about mental health and substance use conditions and where we need to go as a country, as a care system, and beyond.
Don, you've been terrific. It's been great to work with you and Kaiser over the years, One Mind, and the work that we've done on mental health. And I just would love to use this time to really get your perspective as one of those unique kind of payer providers in the country to talk about really how we now look at mental health in a holistic way, because everybody always mentions how Kaiser has a unique approach in that regard, because you take on a bigger fiduciary, if you will, as it relates to being more accountable to putting in place all the things that we know work but don't often get included, whether it's a provider or it's a payer, but kind of bringing the two together. You're able to wrap your value proposition around a more holistic approach to these. And of course, these illnesses, as we've spoken about, need a holistic approach. So could you tell us a little bit about how Kaiser, as you see it, does things a little bit differently?
Thanks for that call out. Let me start sort of broadly about Kaiser Permanente as an entity, right? So it's Kaiser Foundation Health Plan, right? That's the insurance arm that own the hospitals, many employees, nurses, things like that. And then there's the Permanente Medical Groups, which are the doctors and clinical providers, that kind of thing. And you're right. So they are essentially entities that are married together to create an integrated system. So not only do we insure people, but we also provide the care. There are other integrated systems, but we're the largest in the United States. We insure about 12.5 million people across the country, all the way from Hawaii to the mid-Atlantic states. And sometimes I need to step back in my role as a physician within this integrated system and realize that the rest of medicine doesn't really look like this much at all. Like when I'm dealing with family members who have illnesses and they're trying to knit together the different doctors and specialists who aren't working all together, it really looks like a pretty chaotic way to do healthcare. In an integrated system, right, if I'm seeing patients, and this is true for me, I have a patient, maybe they need to be on lithium for bipolar disorder, but we need to manage the impacts of lithium on their kidneys. Well, I have a nephrologist colleague that I can communicate with on a daily basis if I need to, because we're all part of the same system. We have an integrated medical record system. And so just the very nature of our integration allows us to provide a much more holistic kind of care to patients with mental health conditions, substance use disorder conditions, as you're indicating.
This is totally different than what we've been fighting for ages, which is just to get kind of collaborative care codes approved and to really incentivize mental health to be embedded in primary care. You've taken it that much further and saying you can't treat any other kind of, quote, physical illness if you're not embedding and incorporating, integrating mental health with it, because you know that the value proposition of integrating mental health is realized across the whole total medical spend. So as you go into this, could you talk a little bit about that as a factor? Because I really think if we get the true value of mental health, then we're not going to be going swimming upstream trying to get folks to adopt it, because like you, they'll see the value of it in the numbers.
Yeah, I think you're right on there, Patrick, which is, when we think about collaborative care, right? We have a big effort underway to really scale that up and scope it out, right? So we've been doing mental health care and primary care for decades, but as you know, collaborative care has been demonstrated in many, many controlled studies to actually save money. Most of that money is saved on the medical side of the spend, right? So you're talking about people whose diabetes is under better control, who aren't using so many visits because their anxiety is under control, things like that. And we can see that value, right? So it's not something that's like, oh, we did a better job taking care of the mental health stuff, but somebody else captures the value of somebody getting better on the physical side. We have that whole picture. But it's still a challenge, Patrick. I will tell you, when you're doing large scale integration and change like this, it always feels like there's opportunities for us to do better. So if I could take a few minutes to talk about how we're thinking about a real ecosystem of care around our patients, would that be of interest to the listeners?
That'd be great.
So for a couple of years now, we've been on a journey to really look at our whole system and think about how does that whole integrated system bring improvement to people with mental health and substance use disorder conditions. And when we looked at it, we said, okay, we need to do some core things in all of our regions available to all of our members and start with the patient in the center. What do they need? And so one of the things that we knew they needed was they need to be evaluated quickly. Right? A lot of systems, and you know this, Patrick and Marjorie, people, if they can get access to specialty care, they have to wait a long time. And so we said, let's get to them as quickly as we can and determine what it is they need. Where do they need to be on this ecosystem or spectrum as we think of it? Well, one way to do that is virtually, right? And you can centralize where you're doing these intakes with people. They call up, ideally you talk to them immediately. You say, are you ready to talk about this right now? You don't put them in line for 6 weeks or something like that to wait. You say, what's going on? The other thing that we've seen great value with is digital tools. So we've made apps available, the availability of making high quality information available, videos, things like that. I don't know if you're aware of this, but we made Calm and My Strength available at no cost to all of our members, because we thought these are high quality apps. Yeah. And people love it. I mean, we've seen almost 1 million downloads of these apps. And so taking that as sort of the first layer, right? And those are tools that people can use if they're mildly affected or if they have stress and they want to learn about mindfulness, or maybe they have major depression, but these are tools that can help them do cognitive behavioral therapy homework in between sessions. Then you move into the primary care realm. And Patrick, that's what you were just talking about. And we really believe that collaborative care is the way to take care of probably the majority of people with common conditions like depression, like anxiety. And this is well proven. It doesn't draw on a lot of specialty mental health resources, which is really important. And I think we're going to talk about the shortage of mental health providers and training. But it's been shown to basically double the outcomes of treatment as usual in primary care. So, this is something that the whole country should have been doing once it proved itself, about 10 or 15 years ago. And the other thing we want to do in primary care is start to really look at how can we treat alcohol use disorder in primary care, right? We know there are things like screening, brief intervention, and referral for treatment that are quite effective for hazardous alcohol use. But we also believe that you can take steps like simple prescribed medications. Naltrexone, for instance, is pretty easy to prescribe, but primary care providers tend to be kind of shy of treating substance use conditions. And we'd really like to to see that start to happen. And I think that's a big opportunity for our country. And then you move into the specialty realm. Probably the biggest thing we're doing there is really introducing measurement-based care into our practices. This is something you hear a lot about, but doesn't necessarily get done a lot out in the rest of the world. And measurement-based care basically says you can bring measurement science into mental health. And it used to be that people thought that wasn't really possible, but you can. And by measuring, by using what patients tell you about how they're doing, you can tailor the treatment much more effectively. And then we also want to make sure we have things like intensive outpatient programs available to all of our members who need that, because you really need that in-between program between routine outpatient care and the most restrictive kind of care, which is hospitals. So we knit that all together on behalf of our patients in a way that we think very few other entities can do.
I want to give you a big shout out on the alcohol thing because I don't hear anybody talk about it. We're just up to our ears on the opioid crisis, and I'm so grateful for that. But the alcohol crisis makes the opioid crisis look like a poor stepchild. It is shocking to me in the 50 years, and we know how valuable 12-step recovery has been. It's been instrumental in my own recovery. But it's shocking to me that 99% of our response in alcohol use disorder is just detox and rehab, like residential rehab, like that we have not come up with a way to better screen earlier on in the primary care physician's office, in any of their other doctor's offices, early screening for alcohol use disorder. And that we don't just limit it to naltrexone, but that we look at the real nutrient supplementation that is going to be key to reducing the fog of trying to recover from alcoholism, which really leads to the kind of relapse rate. And we have the science on this, Don, which is just shocking to me that we're not using nutrient repletion therapy and giving them a whole host of nutrients that can help refortify their brain so that the therapeutic aspects of recovery from alcoholism can really take place. I mean, it's mind-boggling to me. And so when you brought that up, I just want to give you a big thank you, because I don't ever hear people in your position really going full force on the alcohol problem that we have in this country, certainly which has gone up during COVID, as we know, as many people were at home self-medicating.
Yeah. I mean, first of all, Patrick, I'd like to just call you out and thank you for publicly celebrating your 11 years of sobriety. I think it was yesterday. I mean, that's so important to be public about that. And you've just been amazing with that. And I think it's worth maybe pausing while we're talking and saying, you know, the alcohol situation in our country, I think we've just grown too used to it over decades and decades. And so, yes, the over 100,000 deaths from overdose is shocking, and we need to be paying a lot of attention to that, but we can't forget alcohol. And while we're talking about that, we can't forget cigarettes. I mean, you know, these are all addictions that are killing hundreds of thousands of people every year. And yet there are evidence-based approaches to dealing with it. We've been doing what's called SBIRT, screening, brief intervention, and referral for treatment in our systems for years now. And we've done millions of those early screenings, Patrick, to basically catch people in the hazardous drinking stage and say, hey, you know, you're drinking a little more than is healthy for you. And as your doctor, I recommend you cut down. And as we know from cigarettes, people will actually pay attention to that and go, whoa, I didn't realize I was getting into that zone, doc. And about 25% of people will cut back to safe drinking levels just from that. It's really a brief intervention. And then, of course, you have to have full-blown substance use disorder treatments available for people who are having more major problems with it.
It's so critical. One of the reasons why Don, Patrick, and I were so excited to have you on the show is that, you know, Kaiser does stand out in some real ways because of that sort of bridge of being the provider, and I know, as you described in the beginning, and the payer, and employing your providers, that you are really able to put in a layer of quality because you can. And I know that, you know, we at PsychUp have had a chance to get to know some of your team, especially the ones in the Scholars Academy. And again, another place where I've seen Kaiser really stand out as a thought leader is we have so much conversation these days about access, and there's not enough, providers to meet the demand. And I love Kaiser's approach to it through this like postgraduate training. And I'm just really excited for you to share with our listeners how you guys have gone about with your own employees and empowering them to go to grad school and join the field so the whole Health Scholars Academy, and then the work that you're doing to groom the next generation of mental health providers.
Well, thank you for that opportunity, Marjorie. I'm very excited to talk about it as well. So about 2 years ago, looking out at the field, we realized that there is a dearth of mental health providers out there. And you can break it down and say, well, it's really bad for child and adolescent providers. It's bad for substance use disorder providers. And just generally, we're lacking the workforce that we need. We do postgraduate training. So people who are postmasters, post-PhD, we offer training slots for a year, 2 years, and actually train hundreds of people every year that way. But this really exciting innovation we came up with, something called the Mental Health Scholars Academy, where we basically said to our own employees, if you are interested in becoming a mental health professional, we will pay 3/4 of the tuition at a master's program or a PhD PsyD program for you to do that. Put them through those master's program, but then give them training experiences in our integrated system. So Marjorie, we are super excited to continue that. And one thing we've noticed is that these employees, because they're somewhat older, they're experienced, they're more mature, they're better providers when they get into the clinical setting. So, the diversity, the maturity, it's been a great thing all around.
Imagine if everybody, all the health systems out there were doing something similar, right? I mean, it's a real model of, how to do this. And also it's across the board. It helps. I think it helps internally, and it helps your members too. And so I love that you guys are leading in that area. I'm always really curious about like what we do at Psych Hub, right? Is we train providers on how to use evidence-based interventions and really try to get them using much more precision therapy and collecting outcomes. And this is another place where we've seen Kaiser really, really lead the way. And I guess I'd say put their money where their mouth is, and not only just say it, but actually do it. So I'd love for you to share, just even with some of our listeners, giving them some ideas of some things that you guys have done with, everything from really looking at feedback informed care and then, these kind of evidence-based interventions. So we're going kind of beyond that sort of traditional talk therapy.
Yeah, and I think that's incredibly important, Marjorie. We want people thinking in terms of what's the outcome I'm looking for? How do I want my life to be better? Is it about improving mood so that I can enjoy, my children or my job? Is it about controlling anxiety and having that focus, and then targeting that to an outcome and measuring to get there? So you mentioned measurement-based outcomes, measurement-based care. So we're talking about using called PROs, patient-reported outcomes, where the patients give us structured feedback about how they're doing on validated measures, right? And when you do that, that's probably the single most important step you can take, is to gather that information and then use it in treatment. I do this routinely when I'm seeing my patients, right? We send them a questionnaire that they can answer at home before the visit. I can open it up right before the visit and say, this patient I'm about to see is reporting that their anxiety is better, but their depression is still kind of high. Let's focus on that, right? And so we can dial right in on what their issues seem to be. The other thing is that kind of data can help a whole system get better, right? Because you can look at it holistically and say, well, how do we do at getting people with depression better? In Kaiser Permanente, which of our regions seem to have a better outcome with anxiety than another one? What are they doing? And how could we emulate that? So really getting the data and using it is incredibly important. You also heard me talk about collaborative care, which is an incredibly important evidence-based approach. ESPERT for the alcohol use disorder. I mean, bringing what we know and bringing it to bear on a population, in my mind, that's going to have the biggest impact.
So I want to take a second and explain to our listeners that, there's been this movement around what we call measurement-based care, which is collecting outcomes. And what
Right.
what Dr. Mordecai is talking about is really this next phase of it and really using it as feedback informed care. And I'm drilling down on it because one of them is sort of like a first step, right? You're getting people to actually, whether it's the member or the consumer or the patient or the client, whatever we want to call them, or the provider, to get that assessment and get that information. But then what he's talking about is so critical, because then you take that information and you use it with the client, with the patient, to really inform the care. And if that were done across the board, we just literally would disrupt the way mental health is delivered. People would get much better care. I'm very passionate about this, because it's a win-win for everybody, right? Your patient gets better care in fewer sessions. And most people don't want to be in there talking about what happened to them in fifth grade forever and ever and ever. They want symptom reduction. Your providers are actually a lot less burnt out because they're honing in their craft. They're using evidence-based interventions. They're getting better and better at it. So it's a lot less stressful. And there's a greater total cost of care savings in healthcare. So I just think it's super critical that we just, for a minute, applaud the efforts there to kind of move into that feedback informed care, because it's going to be this critical step to really get quality mental health care out there.
Well, and thank you, Marjorie. And you said it extremely well. And that's what we're about, which is, gathering the data is step one, actually using the data in treatment actively to look at outcomes, to tailor where the patient wants to go, and help them understand when they're better. I mean, some people have been struggling for so long, they don't know when they're, quote, in the normal range again. And being able to say to them, like, hey, what you're telling me is that you're having normal ups and downs. And like you said, it's like, you don't have to spend your time with me anymore. You can go, be with your kids, or, do whatever it is you want to do, is really important. And I think we've also seen that patients actually really appreciate it. It takes mental health care out of this kind of magic black box realm, and helps them really see what we're trying to do, and helps them see how they're a part of setting those goals and the importance of what they do in between sessions to help them feel better. So yeah, it's a crucial part of what we're doing.
So Don, as you know, we've been really advocating for a national peer certification program, and it's now apparent that finally, this is really a priority on the national stage. There's 26 million people in long-term recovery out there. There's so many people with lived experience from both recovery from mental illness and from addiction that could be paired and matched with people who are in a similar kind of condition as they were years before, and who could trust the wounded healer, so to speak, and their fellow who is also struggling with recovery but has a little time under their belt, and importantly has the skill sets that, as Marjorie said, at Psych Hub, we can really do modeling and almost simulation of what, the kind of evidence-based interventions like ESPERT would look like for a peer community. And given the fact you mentioned the dearth in the workforce, there's just not enough people to meet the need out there. Could you talk a little bit about, how Kaiser is thinking about using peers?
Yeah, Patrick, I'm glad you raised that. When I think about where we need to go in our country, I keep thinking of sort of busting out of certain frames, right? So we need to bust out of the frame that mental health care is only done in a specialty setting. Then we need to bust out of the frame that mental health care is only about care, right? In a traditional kind of medical sense. And I think that's where you're going, which is, to me, peers can be this crucial bridge between the sort of traditional healthcare setting, which is important and absolutely has a role to play, and the social setting, which frankly may be more important, right? Which is, when you're talking about recovery, that sort of sense of social connection, of being understood, of having somebody that you can count on, like a peer, with lived experience, is, in my mind, that's absolutely central if people are going to truly recover, right? People can go and get care and take medications and maybe feel better, but recovery is about how do they manage to weave back into their social system and feel like a full part of their community. So in my mind, that's where the peer realm sits. I think we have a lot of work to do in that. We are using peers in some of our regions with a lot of success. So I think that's going to continue to expand, but it seems like a central piece. And like I said, that kind of bridge out to what does mental wellness look like, right? Not just mental health care, substance use disorder care.
All of these issues are so complicated and so compounded now, huh? I mean, we're just in such an interesting time with mental health. I can't let this time go with you and without spending a little bit of time on our youth. It's been such a difficult time for them. Everything from eating disorders to substance use to overdose and fentanyl. And I mean, there's just so much going on. But gaming and this sense of kids living in this virtual world and this new meta world that's in our future. This is not necessarily a role that Kaiser has to step into, but another area where I believe you guys have done some innovative things. And I'd love for you to just kind of share with our listeners how you sort of are tackling some of the work that you guys are doing in that area.
Sure, Marjorie, and thanks. And this is another realm where we're really talking about moving beyond just the traditional care and thinking about, how do we get important messages out there? So, for instance, one of our big pushes is to reduce stigma, and we really wanted to reach youth, young adults with those messages, and so we basically said, well, where are they? And where they are, as you indicated, Marjorie, is online and gaming. And so we decided to join an initiative with an esports organization called Cloud9, which is one of the largest esports organizations. And we basically said to them, like, hey, we're interested in reducing mental health stigma about mental health conditions in this community. Are you interested in partnering with us? And they were all about the sort of health of their team and positivity. And they said, that sounds great to us. And so we joined up with them. We did some training with their esports teams. And then we worked with their esports players, who are very prominent influencers, to bring these messages out to the world. We've done video programs, we've done chats, we've done all kinds of ways of spreading this message, and it's been phenomenally successful. We sort of tied it in with a program that we called Find Your Words, which is essentially a public health program to reduce stigma, provide more information about mental health conditions to people, and iHeartMedia. So we got a lot of iHeartMedia performers and influencers to give similar. Yeah, it was, and we've driven like 3 million visits to findyourwords.org, which is not meant as a Kaiser Permanente site. It's really meant as a anti-stigma information site for people. So there are ways to reach these audiences with positive messages, but you have to be willing to go where they are, frankly.
When we really think about what a future of mental health looks like, it's all of this, and none of it is easy. And most people don't understand, and it's not their fault. It's the whole thing is confusing, which is why we really do this, is to help people understand the why and all of the hard work that needs to be done that isn't always so easy to just go right to the ROI, right? Sometimes you have to really start to kind of go all the way back to, the long play, right? I talk about this at Psych Hub all the time. It's like, we're all about the long play, which is unfortunate, right? We're not in for the quick win. And when you're talking about education and educating an ecosystem, it's a lot of work, but all of the work that you're doing, it's not going unnoticed, and it is going to make a difference. And it's really interesting. And I'm really glad. I know I could talk to you all day. I'm really glad that you took the time out of your busy schedule and that you shared some time with us today. And I know that our listeners have really, you've given them a lot to think about. So hopefully we can have you back on in the future at some point to talk about so much more we didn't even get a chance to cover. But I just want to thank you. It was really, really fascinating.
Well, thank you, Marjorie. Thank you, Patrick. Like I said, I appreciate the invitation. I think all three of us are pretty passionate about this stuff, and it's so important, and there's so much opportunity, which is both what makes it exciting and sometimes challenging, right? Is there's so much to be done to improve the mental health of our nation.
Well, thank you so much, Don.
Look forward to more conversation at some future point.
Amen. Amen. You have a great day, and thanks again for all your leadership. It's really welcome, and we're grateful for it.
As always, thank you for listening to our podcast.
If you enjoyed the show, drop us a review.
If you haven't already, subscribe to our podcast for the latest episodes.
For the latest insights, check us out at psychhub.com.